the diehards.
Right. Well, Mike, do you want to kick this off?
Sure, I'd be happy to, Chris. Well, thank you, you diehards, for logging in. Thank you, Brian, for orchestrating this and getting it ready. Um, Chris, do you want me to do the first couple of slides that provide the background, the project update, and so forth?
I think that'd be a great idea.
Okay, thank you. Brian, could you just go ahead and flip it to the next slide? Thanks. Okay, so, well, all of you received the PowerPoint. Hopefully you've had a chance to look at it. You've already seen this, the agenda, the three major bullet points there being an update, which I'm going to give you, and then going over the index structure and framework, and again with this idea of trying to identify the most pressing conceptual gaps, and then finally some conversation about measure selection. And Brian, thank you. So we had a NAC meeting a few weeks ago, an online meeting, a virtual meeting, and that was a 2-hour meeting, but I'm going to give you the 2-minute summary of it. The high points, I think, as they relate to the model design charge, and then I will ask Glenn to weigh in if there are other important points that came out of that NAC meeting that he does not see otherwise listed here. And I'll do the same for Bob, since Bob is a member of the NAC. The meeting started out with really, I think, a conversation and a question about whether the index has too much of a focus on disaster preparedness. And the question was asked about whether we can shift some of the focus of the index toward this idea of creating healthy, resilient communities with high capacity. And so I think when, with respect to the responsibilities of the model design work group, we might ought to think about this as we consider what kinds of conceptual gaps are currently missing from the index and whether we can fill some of those gaps to satisfy this idea of operationalizing or finding domains or subdomains or measures or whatever kind of nomenclature we want to adopt that reflect this idea of a healthy, resilient community with high capacity. When we posed a question to the NAC members about other important conceptual gaps within the index, there were a few ideas thrown out there. The first one was an interesting one and an obvious one, and that is, can we measure this concept of cooperation between governmental and non-governmental entities? The second was, can we come up with a measure of planning capacity? Folks, I apologize. I don't know if you can hear the background noise, but there's a massive construction site right outside my window here, sort of distracting to me, hopefully not to you too much. The second one, just to repeat, was this idea of capturing planning capacity. And then the third, systems capacity. And this was a little ambiguous to me. The notion, or I wasn't completely clear on what point was actually being made there, but the idea that I took away from it was that we needed to somehow or another capture this notion of do we understand, do we have data that we can use to capture the idea of just really how robust our various systems are. And then we got into the conversation about capability / preparedness, response, and recovery. And again, the idea was, and Bob, I recall you speaking, I think at length about this particular topic, that the index as it is currently formulated is in fact heavily weighted toward capability and preparedness. And there were NAC members who expressed a desire that we that we adopt a more dynamic approach, I think, was one of the phrases that was used that helps us understand what our response capabilities are, and as well as recovery. And so that might be something that we can think about with respect to adding new measures or domains or subdomains. And then finally, we got into this conversation about measures. And as you saw in the slides, if again you looked at them before in advance of this meeting, that we do have a slide here that talks about measure criteria, and this is related to that. I don't want to get ahead of myself, but do add it here because it was part of the NAC conversation. And again, Bob, I believe you were the one who talked about, and even Tom, our chair, talked about this as well, that there are meaningful measures, there are measures that are meaningful and actionable. That is to say, policymakers or decision makers can exercise leverage on the direction of these measures. And then finally, there's the hard reality of what is available. And this is something that Tom talked about. And these are all measure criteria, I suppose, that we need to consider and think about. With that, I'll stop talking and ask if there are any questions, or if Glenn or Bob or anyone else want to add additional information about this.
Thanks, Mike. This is Glenn. I'll chime in. I think you did a good job of kind of highlighting some of the big picture issues that our National Advisory Committee brought to us a couple of weeks ago about, again, ways in which the index might be improved in terms of what we're currently measuring. I might just put a little more emphasis behind I think what we heard from several members around really trying to give much greater weight to constructs around community resiliency. We know this has been an area of rapid progress in the research in the science base around preparedness and response and recovery. So we are as the overall evidence base is certainly growing about the importance of resiliency constructs. There's a need to try to get our index to track more closely with some of those constructs. And I know one of our NAC members, Anita Chandra, has at RAND has been one of the leaders, kind of thought leaders in that area of inquiry. So I know that's an area for of particular interest to her. And I think that also is from what we've learned from colleagues who've been a part of the index from the beginning. We know that's been always an important goal for the index is to improve its ability to expand its ability to represent those elements, the resiliency elements of preparedness. So I think that does remain a important goal. The other piece related to that, I think a number of our advisory committee members felt like the current structure of the index, and certainly in looking at the current measures, the kinds of constructs that were currently measured, still mostly we're measuring capabilities or structures or processes that really fit within in single sectors, or kind of our measures are still fairly siloed. Individual measures that are responsibilities of public health agencies or of emergency management responders or of the hospitals and healthcare sectors, and we really don't have a lot of metrics that really are intersectoral, or that are measuring the extent of interorganizational or intersectoral capabilities related to preparedness, response, and recovery. So that and that obviously those intersectoral and interorganizational issues relate directly back to the concept of resiliency. So So those two, kind of in a broad brush, so at least my takeaway is those are two areas that we continue to need to work to work on in terms of improving the index, improving our ability to incorporate measures of resiliency as we currently understand it, and based on the state of the science around preparedness. And as part of that, trying to build in more, less, silo sector-specific measures and more intersectoral measures or measures of intersectoral connection, capacity, and capability.
Thank you, Glenn. Any other comments?
Well, this is Chris. I have some questions. Bob, I guess you were at the meeting. Did you have anything to add? Just in terms of conveying to this group what happened at the NAC meeting?
No, I think Glenn and Michael did a nice job going over the issues. I mean, one of the things that I struggle with is trying to understand, what our short and long-term goals are, because we still have to produce an index on an annual basis. And so one of the things that I'm struggling with, and I was on the NAC call, I'm a member of the NAC, and I'm probably at the next face-to-face meeting. It's one of the issues I'm going to bring up is we really ought to create a strategic plan about where we are now and what are the short-term goals that we have and what are the long-term goals. It's one of the same struggles we had with the index, and it was one of the things that we had to sit down and discuss and come to a consensus on, is what we were going to accomplish this year, what we're going to try to accomplish next year. And I think the same is true, probably even more so, where we are now, because I think there's, particularly, I think one of the things that's probably one of the most important things we need to do is we need to take a look at those guiding principles and see if they're still the right ones. We have to take a look at the constructs, Presidential Directive 8, the National Preparedness Goals. I mean, this thing was capability based, not on chance. That was a purposeful thing to do, and if the capabilities-based approach is not the right one to take, and it's more about intersector relationships, then we need to go back and ground truth that to what we're trying to accomplish. So I think we definitely need to have. I think the NAC definitely needs to have those high-level discussions, and we need to figure out exactly in the short term what we're trying to accomplish and what we're trying to accomplish in the long term, and then set some reasonable goals and objectives to meet those over the next 2-3 years. But trying to do this, producing an index and producing the index of tomorrow simultaneously, I think sometimes can be a difficult process. So I think it's important we start to have those kinds of discussions.
This is Chris. Bob, I think that's a great point. And back to Glenn and Mike. My understanding from our last meeting is that the hard reality is that if we want to add any new measures to the next iteration of the index, the one coming out months from now, excuse me, not years, the deadline is I think next month, right?
That's right. For new measures that we want to consider for incorporating into the index in the next release, which is December, January timeframe.
Okay.
We need to have those specs in place next month, and in order to have time to do the vetting and data collection around them.
So I guess I'm a little inclined, unless you guys want to wave me off, to have a little bit of this sort of long-term vision discussion right now. I know one of the things we want to get to is what are the domains that we need to build out. But I think this is a prior question. What if anything can we do in the next month? and then what are the things that we need to put on a kind of a longer burn? And there, I think it would be helpful to for us to put our heads together. And I'd be happy we can talk about this offline. Come out with a timeline and kind of a multi-year plan, just so we kind of make sure that we're making good use of the time and expertise that we do have. Does that make sense to have that conversation a little bit here? Or do you feel like would that be a helpful contribution from this group?
This is Glenn. I think it would be. Again, we've got another meeting of our National Advisory Committee next month, and so I think any thoughts that this work group has that we could filter back up to the NAC, I think could certainly inform that discussion. I think, as Bob said, this is also a discussion that our NAC members need to have as that kind of higher level advisory body. But I think this group could really help to stimulate and shape that conversation. So that'd be great if we could have a little discussion on that now.
And I guess I'm standing here kind of pondering. Is there anything that we could conceivably do in the next month that we would that would help improve the next version of the index, or are we really kind of looking towards the next version after that? I mean, I'm just imagining adding a whole other domain sounds a little bit ambitious to me. But on the other hand, maybe there are ways to address, like the issue of trying to play up intersectoral collaboration. I'd have to go back and look more carefully at the measures, but I sort of suspect that it comes up in some of the measures. There are many areas of planning, for instance, that intrinsically, or at least ought to involve reaching out to and engaging multiple sectors. And so, there may be some things that we could do just to kind of bring that out a little bit more as kind of a short-term goal. But I guess I'm wondering if there's much that we could reasonably do in the next month. I don't know if anybody has any thoughts about that. And if there isn't, then we need to kind of get into this what are we going to do for next year kind of discussion.
This is Bob. One of the things that we tried to do in the previous index, and I think we were somewhat successful at it, and I would advocate that we try to do it again, is with each publication of the index. I mean, you need to talk about where we are now and aspirationally where we want to go. And I think if you continue to plow the field where people can see where you're driving the index to, so they understand where it is now, but they also understand where we're trying to take it and what some of the concrete steps might be to get there. I think that's Kathy, I see Kathy Slimp is on the line, and that's one of the things that Kathy helped us do, was to to talk about today versus tomorrow and what we thought was important going forward and what we needed to accomplish over a period of time, and communicate those near-term and long-term goals as we publish each index. I think that's an important consideration. So however we end up deciding where we're going, being able to communicate that and in a way that's coherent and clear, and that our actions meet the roadmap, I think, are very important.
Yeah, this is Jim. Well said, and I agree with you 100%.
Yeah, and that will come some from the NAC Advisory Committee and your all discussion, this kind of group, in terms of if we're able to really define them as short versus longer term, and think about the language around what we really mean by those, because I mean each of these topics that are listed here are strong topics, and not the first time they've been addressed or discussed, and so it doesn't mean it has to continue in the same direction. We can absolutely make shifts. But there are nuances in some of this that it just really takes, I think, that discussion to really grab onto and think about what do we want to do short term, so, and what are the barriers to giving us further, and what is the long-term goal. I think the intersectoral relationships is an interesting one, and the whole kind of system capacity is an interesting one. It probably has a lot to do we always struggle with process versus outcome measures, and sometimes our system issues are more outcome-based. So not always. It would be nice to explore it more.
So given that we only have a limited amount of time, I wonder if we could, just have are there other ideas out there about things that we might be able to do to take the index up at least a small notch, in the next month in terms of, and again, these are ideas, ideas for specific measures, constructs that we can feed to the program office, and then they can, be working on it in the coming months. To me, that this idea of intersectoral collaboration seems like an area where, maybe we can do a little bit of work to take it up just a little bit. Kathy, you were also mentioning system capacity. Do you have in mind, kind of a short-term thing that we could do, again, versus, work that we would do for the following year?
I don't know that I have anything specific right off.
Okay.
I think we try to make the index needs to it needs to reflect the system overall. And so I think the challenge with the index is we tend to kind of break it down into some of its parts, and it really is bigger than that. And so, as in some ways, we're looking at capabilities as reflective of systems. Does that make sense at all?
Yes, system capacity strikes me as a kind of a challenging thing, to describe to begin with, much less measure given the, given the constraint that we have to, rely on other people to collect the data for us. Anybody else have any other areas where, we might be able to conceivably make some progress during this year? Again, I just want to try to triage this out a little bit. Is there anything else? Does anybody disagree with my my hunch that we could do a little bit more to highlight intersectoral comparison or intersectoral cooperation?
I think that's always a good one.
No, I think if you go into, there are measures that currently kind of look at those things, particularly the intersection between emergency management and health emergency management. So I think you're right when you go take a look at, I think it's the community involvement subdomain and the subdomains under it. I think you'll see some of that in there. That may get to the weighting, because we understand that those are really important issues on how the system collaborates and works during a disaster. That may be something that we may want to consider for weighting those measures more heavily than some of the ones which are, just peripherally important to the capacity and the capability. I think that one of the things we should potentially take a look at is if there are subdomains that are missing from the chart, that we take a look and see if there's anything we can do to collect enough meaningful measures to include them. For instance, non-pharmaceutical interventions, non-pharmaceutical countermeasures was very important this last year with Ebola, and yet that entire subdomain is absent from the current set of measures, because we didn't have any information, any measures out there that were collected that we could use to do it. Yet we know that is, particularly in a disease environment, that's a very important set of capabilities to have. So I'm not sure, that's one that's a big one. We already heard from some of the other groups that fatality management is also very important, and we know that one is not currently in the existing set of subdomains because of the lack of meaningful measures. So,
Bob, this is Mike. Let me just interject quickly. Brian, could you forward the presentation to that slide 8 that's titled Prior Workgroup Recommendations? This is directly germane to, there you go, to what Bob is talking about. Bob, sorry to interrupt.
Yeah. And actually, Bob, I want to get to that discussion about these areas in a moment. I'm wondering if we could close the loop and maybe get a sense of clear direction on the intersectoral collaboration piece here, just so we, kind of walk out of here with the ability to give the program management office some clear guidance. One thing that also strikes me about the intersectoral collaboration piece is that is essentially one of the 4 areas of RWJ's Culture of Health initiative, and the kind of the soft launch of that is going to happen actually in a couple of weeks. And so I guess Glenn and Mike, there are a few measures. One that comes to mind, and maybe it's in the index and I've just forgotten about it, percentage of local health departments that collaborated with community organizations in at least 4 public health program areas. And this is based on the NACHO National Profile of Local Health Departments. Is that one already in the index and I've just forgotten about it, or is that an example of a measure where there is data that might might allow us to get at this construct a little more directly?
Yeah, that's a great comment, Mike, and I was going to mention that as well. That particular measure is not currently in the index, and I'm presuming it was left out because that data item that was originally on the NACHO profile survey, which is a survey that periodically is done with local health departments, that item was actually dropped from the most recent profile survey, the 2013 profile survey. So RWJF had to go back, I think, back to the 2008 survey to find that measure. And they're obviously, now that it is being elevated to being one of the culture of health metrics, that measure is going to be re-added to the profile in future iterations. So I would presume that that measure was left off the preparedness index because at the time, last year and 2 years ago, we didn't really have current data on it. But that's going to change. There are a couple of other, I think, culture of health metrics that also get at this kind of intersectoral collaboration that I think could also be good candidates. One is a measure coming off of the AHA survey, the annual hospital survey that asks about hospital connections to public health and other community organizations. Again, it's not a preparedness specific measure, but it is more of a broad-based measure of again, intersectoral relationships that might be relevant here. And there's another one actually that comes off of a survey that we actually conduct out of our coordinating center that looks at a similar measure of connectedness between public health and healthcare and social service organizations. So so I agree, there are a couple of those RWJF culture of health metrics that I think could be very useful in kind of fleshing out this construct on the index. It's just a little bit awkward because those measures haven't been officially announced yet, and they're out, as you know, will be released officially next week. So I think there's some fairly low-hanging fruit in those cultural health metrics that could be pretty easily brought into the index, even as early as the next version if we wanted to act quickly.
Yeah, there's a subdomain called cross-sector and community collaboration, and there are some measures that are somewhat similar to those already there, so we should pull those up and take a look, and these sound like good candidates to add to that.
Yeah, we got a place for them already in the current structure. It would be a matter of just rolling them in.
Okay.
This is Kathy. Those sound like actually really good ideas. The other thing that makes me think about is with the system component. Go back up to the slide that had the NAC areas that we were on before. With the system capacity, it makes me think about the fact that we had talked about looking at subdomains and the strength of subdomains, and potentially do we use weighting or other mechanisms to make sure that it's the right grouping that reflects that capability. And in some ways, in doing that, you're looking at those measures as reflective of the system. And however we do the strength of that subdomain and try to develop it in terms of, is it the right weightings, is it the right combination of measures? I think in some ways we could talk about that as beginning to look at systems. It's a little more esoteric, but it's a different approach to thinking about system capacity. It's actually already built into the index, but being refined this year.
Yeah, this is Jim. If I could add too, getting back to our conversation at the Preparedness Summit, there were a few folks there that really, really struggled with the concept of including indicators around social cohesion. And I raise that because as we talk about shifting or broadening the scope of this, I think that the NAC and the model design group maybe needs to really focus on identifying criteria or parameters of that broadening or shifting. Because, I mean, we, as you all know, we could go absolutely crazy looking at every social determinant of health, every community health status indicator, and seeing if it fits into the niche of health security. And I just don't, while that's not going to give you any measures or metrics for this year's model, I think that will help build a stronger foundation for the out years if we're really going to go down that path.
I agree. I find myself, when I think about the first issue, the too much focus on disaster preparedness versus broader, we really need to think about what's the role of the Health Security Preparedness Index, and we have county health rankings, and we have the culture of health metrics coming out, and we have the Copewell project looking at broader at resilience in some ways. So I think we'd be careful about how much we take on under NHSPI, even though I understand the desire to be all-inclusive. I think we'd be careful with that, too. The other thing that this made me think about was preparedness versus response and recovery. And I know the dialogue we've had to this point has been that in the index is really what the community does in advance before the actual event to influence the response and the recovery. And so while it's not that it doesn't have anything that doesn't relate to response or recovery, it's what do we do in advance to put in place the ability to respond and recover effectively, or to be more resilient. So I think there's a little nuance there too that warrants thinking through. When we say preparedness, we're actually talking a little broader than just what we traditionally use in terms of preparedness activities to actually influence response or recovery.
Kathy, this is Chris. I wonder if I could ask you to repeat the way you draw that distinction between response measures and preparedness measures. I was listening, taking notes, but I want to make sure I get it.
It's essentially, if you ask John Links,
Sure.
He would say it is a preparedness index. It's a National Health Security Preparedness Index. Mm-hmm. And so it is really about what we do collectively as a society and what are the factors and conditions that exist that we do to help minimize the impact of an event on a community. And so those could be activities that strengthen community resilience. They could be activities that put in place systems that support in a more effective response, or systems that promote a more effective recovery or that enable recovery to occur. And I don't know, most measures, I think, it's hard to, the capabilities, we separate them as preparedness versus recovery kind of things. And I'm not sure they're fully as separable as we think they are.
I've struggled with that as well, which is why I wanted to zero in on it a little bit. I guess when I first read that, I thought, well, are they looking for kind of retrospective measures of response, as in, well, how have we done? And again, I don't think that's consistent with at least where the index has been in the past. But I had the same problem trying to figure out what would be a response measure that wouldn't somehow get at what are we doing to increase the odds that next time we need a response, we're going to respond better, which then starts to sound like a preparedness measure. And the same thing holds for recovery as well.
I agree. I think sometimes they're actually already in there, but we term it as part of preparedness. Just because it says it's preparedness doesn't mean it doesn't include efforts that influence our ability to respond and recover.
So one, kind of general observation. I think maybe it's worth just reflecting on what are the things that we could do to improve the index, and our main reason for existence, this committee, is to think about whether we have the right measures. But at least a couple of the things that we've talked about today have more to do with messaging and framing, and so maybe there's some need to revisit how this distinction between preparedness and response and recovery is framed in the index. And then jumping back to the issue about should the should NHSPI be all things to all people, try to address all of these issues related to resilience and community capacity. Another thing we may want to think more about is more clearly referencing some of these other indexes, culture of health and county health rankings being a couple, so that the reader has a little more guidance in understanding where NHSPI fits into that niche.
Chris, I saw a lot of the NAC. I listened into the NAC meeting, and I saw a lot of that is really just because a lot of the NAC is new to the index. And I kind of saw a lot of this as a new group trying to get their arms around the index and what is the index scope and how broad and how narrow and where are the parameters. And so I kind of saw this as a natural part of coming up to speed and thinking through both what is it, where is it, and where are we going to take it. There are discussions that continue to occur each stage of index development, which is great. It's just new groups come on board and need to think through that again and then decide if it's going to continue the same path or a different one.
Good point.
I mean, my 2 cents for what it's worth, I hate making the distinction between preparedness and response and how that drives a lot of the conversation unnecessarily. I mean, to me, preparedness is pre-event and response is during the event. So, I characterize it as can you versus did you. And I'm using one example. I'm just making up. The ability to maintain a 24/7 EOC or hotline. Well, that's a performance standard. That's a capability. You prepare for it and you test and drill in the hopes that you can do it. And then the response is, well, then were you able to do what you planned for? And I think for the purpose of the index, I just don't think we really need to spend too much time and effort now making those distinctions.
Yeah, Jim. I guess I guess just to play devil's advocate on that, maybe one reason we need to at least address it is because it does play so prominently in national doctrine and in conversations about preparedness. So maybe it's just a couple of sentences, and again, I'd have to go back and look more carefully at the website to maybe it's there already, but that seems like a message that needs to be communicated really, really clearly.
Yeah, I agree, and maybe if there's a way we could find out those elements that are unique to response, but would not also reside in preparedness, I mean that may help us through it. But so that's just a thought.
Okay. Well, and I guess another sort of high-level comment. Glenn, when you and I originally talked about this work, months ago, as I remember, one of the things you were hoping to get out of this committee is, not just ideas for measures and things like that, but what are the right conceptual frameworks? I guess for lack of a better word. And it strikes me we're sort of having that conversation right now. Would you agree, Glenn?
Absolutely, yeah, and I think, and also relevant to the comments you just made prior to that, I think the fact that some of our other national frameworks do think conceptually in terms of preparedness, response, and recovery. We at least need to think, again conceptually from the index's perspective, how the index and its components relate to those elements, because we do want people to understand how the index kind of relates to the National Health Security Strategy and to other national frameworks that are widely used that do have that do use those constructs around preparedness, response, and recovery. Even if we don't try to measure those elements explicitly in the index, we need to have some way of conceptually making that connection. It seems to me.
Mm-hmm. Well, and it goes to, one of the selection criteria on your slides, validity. And, validity, of course, is relative to what you're trying to measure. Does the measure what it's supposed to be measuring? Well, you have to have some way of defining, well, what is it supposed to measure in the first place? So I see that we have 15 minutes left, so I'm just trying to, get as clear as I can be anyway about, what our task is here. And, I think I've, kind of identifying three things. One is, in the short run, what are the things, i.e. in the next few weeks, what are the things that this body could do to help support you guys in making some small but fairly quick improvements? And I guess one of those is I suppose if anybody on this group has ideas about unexploited or previously unexploited measures that get at intersectoral cooperation. And so we talked about a couple of ideas here, but I guess if folks have other ideas, send them around an email, and I suspect Glenn and Mike and the team would appreciate that. Mike, Glenn, does that make sense? I'm sort of ad-libbing here a little bit, but is that going to be helpful to you?
That would be, yeah. And I was going to also call attention. There's another slide on the slide deck we sent out for today. I think the one. If you go to slide 9, if Brian's with us and can advance, that slide shows some additional measures that have been suggested to have come to us through our open call for measures that we put out earlier this year. And so we'd also, we'd welcome any thoughts from this work group about the relevance of some of these measures, because we've already done some initial vetting with many of the measures shown on this list, and this list does include, that next to last bullet does include what we've been talking about already, these measures of intersectoral collaboration. I might call attention, the second bullet point there relates to data that we already have in hand from JCAHO, that measure compliance rates with emergency management accreditation standards that are measured by JCAHO for hospitals and for some of the other healthcare facilities that they accredit. So we have those data, we have them in hand, and so that they could obviously be pretty easily integrated into the index if if there's support. A couple of others just to highlight real briefly on this list. Measures of infrastructure reliability. This has been suggested by several different groups as a fruitful area for thinking about again, incorporating additional measures into the index. Another member of our, I believe of this work group, is not with us, but David Eisenberg from UCLA gave us a list of measures that have been identified by the National Institute for Standards and Technology, NIST, in the Commerce Department. So there's a whole suite of metrics around infrastructure reliability that are available, that have been vetted through NIST as being relevant to disaster preparedness that we could think about. So these are a few other items we've been pondering and doing some initial vetting.
Okay. Okay, so yeah, and then the two other things, and I think, Glenn, maybe your comments kind of get us in this direction. The other things that I gather are things that we won't be able to fully accomplish in time for the next index. Most likely would be to identify what are these other domains that we need to go into, and so I guess I'm hearing agreement that intersectoral cooperation is something that's already in the index, but it's something that we can and should bring out more clearly. And so that strikes me as something that we could do fairly quickly. But then, going on into subsequent years, then we get into this bigger question of the list of things that were identified by Bob and Kathy and the others in the previous group, non-pharmaceutical interventions and things like that. Which are the ones that really ought to be the priorities? And strikes me that that's a discussion that we need to have over the next several months, most likely. And then the third thing, I guess, that I'm hearing is, can we help support you guys in kind of clarifying the conceptual narrative about what is the NHSPI about, and how does it sort of fit in with all of these other kinds of constructs. So I guess I'm just trying to think of how we operationalize that, and would it help, Bob? You mentioned coming up with a little strategic plan of some kind. Would it help for us to and here, I guess I'm thinking us as me, myself, and you guys in the program officers to do a little brainstorming in the next month, maybe draft some ideas for what a plan, a work plan might be, and a timeline, and bring them back to this group. Would that be helpful for broader discussion?
I think it would be extraordinarily helpful. That's just speaking for myself, but I'd like to hear others' opinions.
I definitely agree. I think that would be very, very helpful.
Okay. And I guess just as a matter of process, I know it's hard for a bunch of us on a telephone call to collaboratively put together a coherent a proposal. So I'm thinking that it might be helpful if we could get something on the table, even if it's kind of at the level of a few slides and bullet points, and then get people's reactions to that.
Yeah, putting up kind of a straw man and then fleshing it out through a conversation.
So this is Kathy. That could also be helpful. I know Brian's been thinking about putting together PMO calls with the chairs, the work group chairs and things too. And that's a group that too could help refine that some before it came back to broader group to look at feedback on.
Okay.
Focus on that. I think that would help everybody get on the same page with that too.
Right. Yeah, I kind of feel like we're still trying to kind of figure out what's our mission, and then what's the role of this body, this committee, and how can we most help the program management office. Okay.
Well, the other thing is just again from my standpoint, if and I've been sitting on the multiple committees, so I'm in a fairly good place where I can understand how the committees are intersecting. But if we had that overall strategic plan, and we had a series of objectives, I think you could make it very clear to each committee what their objectives are, so they would see where they fit in the bigger process.
I have to confess, I'm doing a project on governance structures now, so I'm very attuned to these issues. So my worlds are colliding here. So it sounds like we have some sense of process here. We do have a few minutes left. Would folks like to offer some thoughts on these other domains, NPIs and infrastructure reliability? Maybe if we take advantage of the last 7 minutes to get a little discussion on that, and then maybe we can try to reflect that in the straw man document that we talk about. So I think somebody made a good, strong case for NPIs, just given its importance in Ebola and the clear weaknesses as well as strengths that we saw in the system.
What's that?
Yeah, I'm looking at your additional CAM. I'm just looking at this slide, and I see workplace policies, paid time off, telecommuting. I mean, they're all might be good proxies for non-pharmaceutical interventions in the workplace. So interesting to see what measures we have in those areas.
A lot of times the limiting factor was just where those measures available, and I guess one of the things I'm wondering if you're thinking about new measures need to be defined by next month. What's the process for taking the collection of ones that you've got as proposed and kind of going through those and winnowing those down into what might be the best new things to add?
Yeah, well, what we've done with these measures that have come through us through our call for measures, we've done initial vetting to get tighter specifications on them, and then done the initial search to look at the data availability issues, and we're scheduled to provide kind of our assessment of that back to our National Advisory Committee for its in-person meeting, which is next month. So that
goes to the NAC. It doesn't go to the model design first.
Well, I think we'd certainly love to have this work group also weigh in on that. In fact, if there's we could certainly again run those issues by this committee one more time to have a chance to this group to weigh in as it filters up to the advisory committee.
So would that be like a list of the candidate measures and discussion around them, or voting on the strength of them, or what's your best process that would be helpful to you all through this or another?
Yeah, I think, and this is just me. I welcome other people's thoughts here. I think, again, if we're thinking about, back to Bob's issue about short term versus long term. I think, our first consideration would we'd want to get a sense from this work group as to which, if any, of these suggested new measures would seem to be ready for consideration for short-term incorporation, meaning the measures look solid from a specification standpoint. There's evidence behind them around validity and reliability. They look solid in terms of data, from a data availability standpoint, that we can get data on the measure that cover at the state level for all 50 states, and that it's not just a one-shot data source, but there's an ability for updating those measures, continuing data collection over time. And then thirdly, I'd probably say, again, for the short run, for measures that we're thinking about adding into the index for this next iteration, I think we really have to look at the extent to which these suggested measures fit into the existing conceptual framework and structure for the index. If there's not a home for a measure in terms of an existing domain or subdomain, then we're probably not ready to stand it up in this next iteration, because it would require some reconsideration of the index structure. But those would be issues that I think we'd welcome feedback from this committee, and I think and that we'll also need to get the feedback of the National Advisory Committee on those kind of issues, in order to make a decision about which, if any, of these suggested new measures we try to stand up in the new in the next iteration of the index.
Okay, well, looks like we're just about out of time here, so I think we have a few action items here. One is, again, for all of us to share any suggestions about a couple of things, measures that get at this issue of intersectoral collaboration, which does seem like fairly low-hanging fruit. Look at the additional candidate measures that are on the slide that's up on the screen now, and weigh in on those. I guess applying the criteria that Glenn just mentioned, and I want to underscore, I guess, from my own perspective, the importance of the need for these things to map onto the current conceptual framework. I think might be problematic to have measures sort of hanging out there that don't kind of fit into the overall conceptual framework. And then I think next time we meet, we'll have at least a skeleton of a proposed strategic plan, work plan that kind of lays out what we might do in the next year versus the following years. And we'll have hopefully a robust discussion of that and improve it. And then, down the line, I will have to talk about how to sequence this. I'm thinking it might be helpful to maybe devote the better part of an hour to how the index interfaces with some of these other conceptual frameworks, and where it sort of fits in with the preparedness, response, recovery issues that some people have commented on today.
Chris, you've mentioned applying those criteria, these candidate areas, and I guess I'm trying to think through, and somewhere there's a step of applying it to not the candidate areas, but the measures themselves, the listings of measures that are proposed. And so if there are ways that others of us can be helpful to looking at that candidate list and thinking, yep, this would fit well here, or this looks like it's strongly reliable from our perspective on things, whatever would be helpful, so that the PMO can winnow that list down to a point that that it's easier to present to the NAC to have further discussion or other kinds of things, let us know if there's measure-level reviews that you want people to do. At some point, at the end of the day, you've got to apply the actual criteria to the individual measures.
Right.
Yep. Good point.
Okay. Well, I guess I'll hand the baton back to Mike. Anything you want to say before we close out, or Glenn?
Well, yeah, Mike, go ahead. Sorry.
I'm sorry, Glenn. Just thank you, everybody. Glenn, go ahead.
I was going to say thank you as well, and thanks to Chris for your leadership on this work group. We've got good notes. I know, Chris, you've got notes, so we'll kind of feed this back out to the committee and with confirmation about next steps. But obviously you don't need to wait for that to hear back from us. If you got further ideas following up from this call today, just feel free to give us a buzz or shoot us an email.
All right, thank you. Bye.
Thanks so much. So long, everybody.